the City Futures seminar for today. This is our fourth of the term. We've got two more coming up this term. At the end of the talk today, Rupal will tell you a little bit about the next upcoming session, but just to give you a little preview, it'll be in Parramatta. So if you're coming live, please know that it's there instead of here on the Kensington campus. So just a little housekeeping before we start. If I could just ask everybody online to at least mute your microphone during the presentation. And then if you've got questions along the way, please feel free to put them into the chat at any time. Or then once the presentation is finished and we get into the Q&A, you can raise your hand within Teams to let Rupa know that you've got a question. And Rupa will be coordinating the Q&A after the talk today. So I want to introduce our introducer today. Hazel Easthope is an associate professor at UNSW and the assistant director of City Futures. And she joins us from not quite her sick bed, but she's recovering from bronchitis from home. So she's joined us online. And so I'll turn it over to Hazel to introduce our speakers for today.
Thanks very much, Lee. Welcome, everyone, especially big welcome to Brenda and Susan, our speakers for today. So Brenda, it's wonderful to have you present at the City Futures seminar. Dr. Brenda Lynn is a transdisciplinary ecologist, and she leads the Adaptive and Livable Cities team at the Commonwealth Science and Industrial Research Organisation, otherwise known as CSIRO, which is the science arm of the Australian government, for those of you who didn't know, but I'm sure you all did. She researches the global environmental drivers of landscape change and the effects on ecosystem services, especially climate regulation and impacts to human health and well-being. And she's got an exciting career history. Prior to the CSIRO, she was at the US Environmental Protection Agency and also at the Earth Institute at Columbia University. So we're very pleased to have you, Brenda. I'm looking forward to hearing from you.
Thank you.
Co-presenter today is Professor Susan Thompson, who doesn't really need an introduction, I think, to most of you, but she's going to get one anyway. She is a Professor of Planning and also Associate Director at the City Futures Research Centre in the School of Built Environment at UNSW. Susan is an urban planner, academic and teacher. She's been at UNSW for over 30 years. And of a special note, she's one of the first urban planners in Australia to advocate for the importance of healthy built environments, and has done so with gusto and incredible skill over many years. So Susan, welcome. And with that, I will hand over to you both.
Thank you very, very much, Hazel, for that very generous and warm introduction. And I want to also say, given that I am from City Futures Research Centre, a particular welcome to Brenda, and how delightful it has been to be working with Brenda and learning so much from her. At the outset, we both wish to acknowledge country and pay our respects to the First Nations people, the stewards of the natural environment for over 60,000 years. I'm currently today presenting on the lands of the Gadigal and Wongal people of the Eora Nation in the inner west of Sydney, and Brenda is on Benawara country in inner west Brisbane. So we're really delighted to both be here and to pay our respects to the First Nations people. In the presentation today, we're going to provide an overview of a small piece of a much larger research project examining park quality in relation to health and well-being. Specifically, our component is a piece of qualitative research. It's pretty tiny, really. It's a focus group and we're going to talk about the method and the participants of the focus group. But mostly we're going to spend the time today talking about the analysis, the presentation of the themes that have come out of this piece of qualitative research into park quality and health. And we're going to end a little, somewhat provocatively, perhaps won't be that provocative, don't worry, but as a possible starter for some discussion. So it will be interesting to see how that goes. I've not done that before. Now, this is as I said, a tiny piece of a much, much larger project. And it's actually a project from being undertaken by researchers in the UK as well as Australia. It's funded under the UK Research Innovation Council and the Australian National Health and Medical Research Council via a particular program that those councils got together on in relation to looking at specific aspects of the built environment and health. And this slide shows the expansive research team that we are a part of. And there's a variety of researchers across public health, medicine, policy analysis, environmental science, and planning. And the project is led by Associate Professor Xiaoji Feng from the School of Population Health in the Faculty of Medicine and Health. And Xiaoji is the Australian CI leading the project from the Australian end. And in the UK, the leader is Professor Rich Mitchell, and Rich is at the University of Glasgow. So we have some interesting meetings sometimes comparing different weather scenarios and so on, but that's the research team. And as I said, we're just a small part of a much bigger project. These are the research project aims in a nutshell, and these are the big aims of the entire project. Oops, I think I've gone back a slide. Sorry, I was. So firstly, can you still see my slides?
No, I think the slides are gone now.
Wow, okay, I don't know what's happening here. So I may have to go back and share. They've totally gone, haven't they? This is testing my calmness and my ability to maintain my blood pressure at a reasonable level. Can you see them now?
Yes.
Yes, we can.
Right.
They're there.
Okay, right. Maybe I was waving my arms around and it didn't like that, I don't know. These are our research project aims. First up, to co-produce evidence about which qualities of green space contribute most to the prevention of poor mental health and cardiometabolic disease. That's disease associated with the heart. Secondly, to measure green space qualities and related contextual factors in cities right across Australia and the UK. And thirdly, to establish what's called the prevention potential of the green space qualities so that we could potentially maximise the contribution of urban green spaces to preventing and equalising these non-communicable diseases. So I want to briefly, just to set the scholarly research context for those of you perhaps who aren't familiar with this area, but just a few key points. First up, there's an enormous amount of scholarly work on the multiple health benefits of green open space. And a lot of this has been driven by a key hypothesis and a key theory. And the key hypothesis is the biophilia hypothesis, and that was proposed by Wilson back in the mid-80s. And essentially, this is about the ways in which humans are hardwired to have a close affinity with the natural environment. And the theory that I wanted to mention is attention restoration theory, or ART, A-R-T for short. And this was proposed by Rachel and Stephen Kaplan back in the 1980s. And this theorizes that being in nature calms us down. And I'm hoping that through looking at some of the images in our presentation, that will be calming for you. But let me just read what I think is a great quote from the Kaplans about their attention restoration theory. And I quote, "In the stress of urban living, crowding, traffic, overload of stimulation, lack of peace and quiet, all take their toll. In walking from one point to another, one must discriminate, screen out extraneous stimuli, pay attention only to those signals that are relevant to the journey. The mental faculty that performs this screening becomes fatigued. Vegetation serves as a shock absorber for the human sensory system assaulted by the sights, the smells, the sounds of the city. It does not present a challenge to the senses. It does not have to be screened out, but provides an opportunity for rest from the constant mental alertness." And I'm sure many of you can well relate to that sense of being in the city and then being able to seek solace and restoration in green open space. There's some really good work that looks at the benefits for physical and mental health of green space across the life course, and there's a nice paper that does this, which I can tell you more about if you're interested. Another very, very important theme emerging in the area of green space and health is the multiple co-benefits for environmental health and sustainability. So action for human health in relation to green space has incredible and important, significant benefits for the health of our planet. But what we don't know enough about is to what extent do different qualities of green space affect health in varying ways. And this is where this current project comes into its own. So, as I said, this is the first stage of this big research project, or a small component, and these are just sort of the normal things that any research group goes through, getting ethics approval and so on, determination of key focus group questions, and this in itself was an interesting project across both of our teams in the UK and here in Australia, and it led actually ultimately to a nice simplification of the focus group questions across those three key themes. But what I want to just dive into slightly deeper is the ways in which we needed to make some quite significant adjustments because of COVID, and how we needed to change the original proposal, which was to conduct a World Cafe, which would have meant people coming face to face and considerable interaction. And we spent a lot of time thinking about, well, how could we come up with a reasonable equivalent? And I was proposing to read some detail of the report that we've written about the research, but I'm just conscious that we won't probably have a lot of time to do that. But essentially what we found through thinking about what we aim to get out of using the World Cafe approach was that our qualitative focus group with key experts in the field and with facilitators that were experienced in running focus groups, essentially Brenda and myself, that we would be able to come up with a reasonable equivalence, perhaps not quite as much interaction, but we felt through the conduct of the focus group as experienced focus group conveners and that we felt that it did run well, and that the feedback from the participants at the conclusion was that it had been a positive, enjoyable and productive experience. Our focus group participants came from those groups that I've sort of just named there, from park policy makers, park providers, public health people. We also had other different officers from different levels of government associated with park policy, thinkers in terms of their aspects about future trends for parks, park designers, advocates, and was across the private, the NGO and government sectors. Identification consent varied across the group. So because of this, we decided that we would de-identify all participants. So we quote quite liberally from the focus group in this presentation, but we provide no identification to respect that consent variation. Now we're going to turn to the thematic analysis, and Brenda is going to take us through that. And I'll be the...
Thanks, Susan. Okay, so we had 3 themes that we discussed with the focus group across a period of 2 hours, and it went very quickly. The first one was, what is park quality? And one of the aspects that came up immediately was that we couldn't just talk about park quality in general. Susan, will you go to the next slide? Thank you. Rather, that we had to think about parks as a whole, not as singular individual parks that exist, but how do they contribute to the landscape and to the community as a whole. And I must admit, as an ecologist, that makes sense. But as someone who has studied green spaces and the benefits of green spaces, what we have done a lot is try to look at different aspects of quality of parks or different types of vegetation and what that might mean to environmental quality or to different other ecosystem services that it provides for communities in that space directly. But thinking about the connectivity of space was one very important aspect of this discussion, because the network of different spaces actually provide multiple types of different types of parks that can be used, and the diversity of uses and the difference in topographies actually has a value in and of itself. So when one of the focus group members said, it is really the idea of that interconnected network of open space parks and of various sizes that actually delivers that quality that we want from parks. Another aspect of park quality that was brought up is not just the provision of parks, but how do we make parks more how do we create different activation of parks? How do we create different types of spaces within a singular park? And sometimes that includes aspects such as planning for different types of recreation that can happen in a park at different times, in different spaces in the park. It provides multiple ways that an individual that comes into the park can actually interact with the park. And sometimes people need signposts, not just to have a park there, but, oh, this park, there's different ways that you can interact with. You can exercise, or you can play, or you can have a picnic. And so it's about trying to understand what the context of how people want to use parks, and try to also provide the programs that people would like to see in the park. So it's not just, as one of our focus group members says, it's not just the barbecues or the bubblers. It's the programming of activities, and then how people feel about the space, how they can connect to it and to each other in that space. So it's creating much more than just the physical infrastructure. I'm sure this is something that everyone has seen time and again, but getting to a space, being able to access a park space is really important toward quality and how people think about and value a park space. So is it walkable? Do you need a car? If you do need a car, is there a place to park? Is it easy to park? Is there disability access, ramps, facilities such as bathrooms for people that need and want to use that space? So one of the examples that a focus member gave is that with elder citizens, active senior citizen engagement in spaces and connection is really important, but that's why we have to also think about all the ways that different people across the community also access that space. Providing thermal comfort. This has become an increasingly important aspect of parks and how people use parks and why people use parks, because parks generally have 30 to 40% tree cover. It provides shade that often in smaller housing lots, there are no trees. And so shade is either left to the streetscape or it's actually it doesn't provide very much coverage. Facilities for cooling, such as water fountains that allow for evapotranspiration, can all increase the climate adaptive space that a park can be for the community and impact on human health and livability for that community. So what our focus group members have seen is an increased demand for these climate adaptive green spaces, especially when we think about longer heat waves or increasing temperatures. So we're not just delivering open space, but quality open space that is usable and livable as well. Another aspect of quality that was discussed quite a bit was the provision of a space that allows people in cities to get away from the crowds, to get away from the city. So it provides nature spaces, informal spaces, and spaces for a bit of solitude. So one of our park members was talking about, one of the focus group members was talking about a park and said that they went to a park where there was no crowds there and it was just joy. Another focus group member really emphasized that people needed to get away from the crowds, getting away from that feel, that urban feel, especially if they live in high density or crowded areas. And this has mental health benefits for the community to be in these areas away from the city. Our second theme was really looking at how can parks specifically contribute to human health. This came out in a number of ways. One aspect was how can it contribute to physical health? And definitely parks provide a space for physical activity. And this can be, it can be running, it can be walking, it can be a space for exercise, but it can also be a place for incidental activity. So designing parks that are along a route that people walk, right? Or if we know that there are two spaces, a grocery store and a train station, that there is some type of way for people to walk between those two spaces. And it also helps with recognizing that physical health, physical activity can actually contribute to mental health as well. So in one of the councils, what the focus group member said is that people commute a long way to work. They don't have time to be spending at a destination. So what's really important is for that green space to be along the travel routes, to be built into their daily lives so that it becomes part of their daily commute. Okay, so parks can also be important spaces for social connection. And these are places that are open. They can provide, they're almost like public backyards that allow for social interaction. They can be public living rooms, especially in compact urban spaces. And these are free spaces for people to access. So a lot of places that we want to spend time in cost money, but places like parks are actually free. You can spend as much time as you want there. And so that is really important for social connectivity and equity across communities. So in one council, they said that high density living is a relatively new thing. And so we're just starting to look at parks as public lounge room spaces. So people don't have larger spaces in their houses or in their yards, but they can go to a shared park, and that can become that shared public space that they can use. Providing green natural areas. As Susan was saying, this idea of biophilia for health, biophilia has that human experience that humans might desire to spend time in nature, came up as an aspect of actually having health benefit as well. So there is a lot of evidence around how interacting with actual green living things, that interacting with a green actually has a physiological benefit. It's not just about walking and physical activity. It's about being in green space that provides that mental health benefit. Again, this idea of parks providing respite from urban life was an important part of that health discussion. Getting away from the busyness of life, having unformed activities in parks, having not necessarily always having everything programmed in parks can actually be very helpful too. So it's not a place where you necessarily have to have prescriptive recreation, but people can shuffle. They can amble at will in places without any shape to what's required of them. So really getting away from the stress of life and having every activity planned. There's also the role that open space plays in people getting away from crowds, getting away from that urban feel, like what we said before, to find some peace and mental health benefits that come with that as well. Being in touch with nature rather than other people. So I think a lot of these themes are really coming together to shape that they're interactive too. They interact. That getting away from urban life, being able to be in nature, being able to find some time alone is actually quite important for health benefits. An interesting topic that also came up in this discussion is that parks can be a place to help develop resilience, especially for vulnerable populations or underserved populations. They provide a space for building community and community resilience, for that connection within that community. But there was also discussion from one of the focus group members about designing parks that actually build resilience in young people. So that provide for youth well-being and youth mental health by connecting people to green space, which is free, but also providing a space for young people to kind of discover their own abilities or own role in park space and how they can activate their own life within these park spaces. Again, the topic of heat was really important. And I think because a lot of Australian cities, and especially in Western Sydney, there have been a lot of heat events that that really require communities to find ways to cool down. And parks are a free way that councils can provide shade, to provide water features that actually allow for people to stay, to sit, and to cool down. Providing shaded paths and routes to get to public transportation can also be important. So one of the councils said, how do we as a council deliver footpaths in parks with a green walkway for someone, such as a nurse who needs to get to work, to get to a bus stop, to get to work, which impacts her ability to provide for her family. And so these heat and well-being impacts often get lost in that conversation. The third theme was, how can we assess park quality? And this was actually the most difficult conversation for the focus group. Will you go to the next slide? Thank you. And part of this difficulty was that many of the practitioners felt that they still needed more data to assess parks. They needed data from organizations that they really had no control over that might have data, but it's not shared freely, and so there's no access to it. There was also a desire for some kind of standard in which we could start assessing parks and park quality. So one of the focus groups said there isn't sufficient research or data that is available to support designers to understand how to make better quality parks. There's no standard that enforces how tools are applied in understanding what is the quality of that park. And so this need for standardized process was definitely expressed across the board, because evaluating parks currently is very difficult. There's multiple criteria. There's criteria that occur from the community, which changes based on context. There's different criteria in terms of investment, return on investment. So what many of the park designers said was that what the need is in the area, what that park or open space is there to perform as. That's what they're looking for in terms of trying to understand how to standardize it. But it is so context specific. There are a couple of data types that are currently being used, such as thermal heat maps. Some areas also use different environmental performance criteria in terms of biodiversity, in terms of water flow through, but there's not no design criteria that park designers and park planners can use right now to really understand what data types should be used for what kind of assessment. So one of the local government areas said that they have thermal heat mapping, but there are other aspects of quality park design and environmental performance and human performance that aren't well defined at this point. So without understanding what they need to measure against, it's also hard to understand what data to use, and then what processes to use to measure that. I will pass over to Susan now to discuss the summary themes.
Thanks, Brenda. And I'm just going to wrap things up now by going through some key summary themes and then a couple of unanticipated themes, and then ending on the provocative note. So the participants agreed that place-based approaches are critical for planning and designing parks that the community want. In essence, the social context often determines the design and the use of the park, and arguably it should, and they talked about that. There's also a need to consider co-design and work with stakeholders to develop the best and most appropriate park if the local council is to gain support for the development and design of the park. One of the focus group participants said, I think one of the underlying things of this whole discussion is really about the importance of a place-based approach to parks. Really making sure that parks respond to the local context, both the local community, the local historical and cultural contexts, connections to place and connections to country. And I think these place-based approaches came out as being so important because, and there's a quote here, not on the slide, but quoting one of the focus group participants, we don't just go there to recreate. The parks are delivering many other benefits to the city, to the people who live near them, to the people who come to visit them. The issue of connectivity of green spaces and the importance of a network was stressed and reinforced throughout the discussion, and Brenda has talked quite a bit about that already. A couple of the points under this summary theme came out in relation to, well, not all spaces have to deliver everything to everyone, and then this network of spaces can be then seen as a whole, and that's embodied in that particular quote. The next summary theme is about designing parks, green spaces to support health and well-being, and I probably should add here, of both people and the planet. And that really comes out in that first point in relation to the planet, but also to people, resilience building, making sure that we are more and more removing the car from our environments, providing lots of opportunity for incidental exercise, as well as, you know, those formalized activities, and the issue of thermal comfort. So parks can definitely be designed to deliver multiple health and wellbeing benefits, and obviously not everything is necessarily supported by a single park, and then that's got that link with the importance of the network of parks. Green spaces designed for social exercise or organised sport may offer different physical and mental health benefits when compared to a park principally designed for opportunities to engage in nature play and different interactions. So we've got all these different sorts of activities happening in our parks, and so much of that is around health and wellbeing, and this came out very, very strongly in the focus group, as did the issue of how we need to design for multifunctionality. And this speaks to the issue of not all green spaces have to deliver everything to everyone. So parks, as the participants talked about it, will serve a range of purposes to different segments of the population. So again, this network of green open space should be seen as a whole rather than as individual parks that exist in a vacuum. As a network, parks should deliver a multitude of purposes meeting disparate goals, but individual parks may only serve one or two functions. This way, the network of parks as a whole can serve the diverse needs of an entire community. And planning for parks that are multifunctional can allow for several benefits to be accrued at one, such as social connection, recreation, relaxation and environmental sustainability, cooling and habitat protection. So all of those sorts of things can come together. The next just couple of sort of wrap-up points I would like to make about some of the unanticipated themes. The first one is, I suppose, a notion around innovation, and some of the participants in the focus group talked about the need to upend the system of design principles. So really talking about the need to concentrate on first how we want communities to live, and then designing infrastructure accordingly, not the other way around. So one of the participants said, we should be designing by starting with the blue, the brown, the green, and then the grey. We do the exact opposite in planning. In other words, you know, we should be first understanding the natural environment and designing the city around its context. Similarly, and this person went on to say, we should be starting from the pedestrian, then the cyclist, and then and only then the car, and then the speeds of those cars. Another perhaps unanticipated theme, or maybe it shouldn't have been, but I think it was the notion of park design and purpose being a driver, or resilience as a driver, sorry, for park design and purpose. So the notion came through the focus group from a lot of people talking about how we need to view park design and purpose through this lens of resilience and the ways that green spaces can support communities through hard times. Now, of course, there was a lot of discussion about the pandemic during, our focus group, and people talked about how the pandemic has shown us how much the community relies on public green space for respite, for exercise, and a safe space for interacting with others. And I'm sure all of you have experiences of that. One participant stated, "We would never have predicted its role, the park's role in resilient communities through COVID. And it's likely that this need will only become greater with time as communities face other pandemics and associated challenges, particularly including those associated with climate change." And I think a further point here is ensuring equity of access to such spaces will become an increasingly urgent and moral environmental justice issue. I think this is not quite the final, certainly the final, perhaps unanticipated theme that could be summed up really around the point of the centrality of park provision for government. So this notion of a cultural shift to see parks as critically important places. So the people in the focus group talked about the importance to change the narrative of parks to create this cultural shift where politicians and governments see parks as critically important, as underpinning the health of people and also the health of our planet. And this is just going to get more and more important. And it was great, I think, to see that come through this focus group. And this is just a final point, not so much an unanticipated theme, but just something to sort of sum things up in terms of the importance of co-design. So working alongside the community, getting stakeholder buy-in in the design of parks, and thinking about the ways in which parks as a network can come together to meet multiple needs, not necessarily each park meeting all of those needs, but as a network of accessible parks to everyone in a community, just so important. So this person just talked about the importance of bringing the community into the discussion, then etc. You get their buy-in, and they feel they have had a real hand in coming up with the design, with what the park's all about, and defining it for themselves. And just making the point here as well that it's all about context. It's about the community's context, the uniqueness of the community, but also the context of the topography, the climate, and the area that the park is to be situated within. So here's our provocation. Maybe it's not that provocative, but we just thought we'd end, rather than just opening it for Q&A. And please, if you don't wish to talk about this, that's fine. But if you do, that would be great too, because that would be interesting for us in particular. But we're happy to answer any questions about the project, anything you'd like to raise in discussion. But I guess we are concerned about, well, how do we then now, within this bigger study, which is very focused on quantitative measurement and data collection, how do we take the understandings that we've clearly been able to garner from our focus group, how do we take those understandings and how do we capture those, because they represent a wide range of park qualities within a reproducible quantitative measure or measures. And if we do manage to do that, will that be meaningful? Will we be able to do that in a way that doesn't then reduce the breadth and the richness of the qualitative data to something that's possibly measurable, but that denies that richness and breadth. How can this be mutually beneficial for all the stakeholders as well as the environment, given the urgency of meeting health needs across people and the planet? And what's the role of dialogue here and any other issues? So thank you very much, and we look forward to hearing your comments and your questions.
Thank you so much, Brenda and Susan. Can you see me? Oh, camera has seemed to have moved position. Yeah. Thank you so much for that really insightful presentation. That was wonderful. I have a few questions myself, but I'll wait for the questions to appear from the online and in-person attendees.
Yeah.
Oh, yep, there are some hands up. So we've got Hazel and see, I need to go and get my
It's Jack.
I think it's Hazel and Jack.
Hazel and Jack. Yep.
Okay, I'll kick off. Great presentation, and Susan, I was excited when your provocation slide came up because that's exactly what I was thinking about while listening to the presentation. How are you going to deal with, on the one hand, this call for data to help decision making and to justify resource allocation, and on the other hand, the need to have bespoke answers and responses for each individual park. And I think maybe one answer possibly is to think about the quantitative information as forming a toolkit that can be used in those co-design situations. So, you know, if you've got quantitative data that tells you that the health impacts of something or the cost of something in particular that you could do in a park, then that's information that can help people when they are participating in a co-design process for a particular park in a particular context. I think that could be really nice way of combining the two. I don't know. I'd be interested in your thoughts on that.
One word, bravo. I like it. But I'm also really interested to hear from Brenda. What do you think, Brenda? I think that's, yeah, it's a...
Yeah, I do like that idea. I think I work a lot on climate change as well. I think that's kind of the way that we approach that there is all this information out there that can help us make decisions, but then in the end, the decisions are based on the stakeholders and all the individuals that are actually impacted by it. So there has to be some combination of bringing together that data with an understanding of the values and the needs of the community in order to make meaningful decisions.
And I think I actually heard a very interesting talk last week from somebody who was not discussing this particular topic, but looking at data, quantitative data, and then also looking at qualitative work. And the speaker said that we mustn't confuse data with understanding. And I thought that was really insightful, and also that need to understand people's experience of place. And I think, yes, we can give them information in the toolkit, and that will help, but we also have to sort of listen to, well, what is it that they want to be doing in the parks, and how can that be provided for in a way that then makes them feel that they have been listened to and that the park then ultimately is meeting their needs. But it's a big, maybe a big conversation. But I'll be interested to hear Jack's, because I know.
Yeah, nice.
Jack's
Great. Thanks, Susan and Brenda. Very nice presentation. And I think at that harder edge, there's I remember, 20 years ago with the Olympics, that's the first time I started to see tent communities kind of forming in our parks, and if there's a community need for, living and dwelling, a lot of people might perceive that as being a negative thing with parks, something that, shouldn't be happening. Or is this an opportunity to interface with those communities, or what are your thoughts on the harder edge of the park where it might not be, well, where sure, there are a lot of benefits to parks, but also places that attract people that are really in need.
Do you want do you want to expand a little bit on that? Do you think some people in the community where the park is situated may object to certain people coming to their park, and is that
that's not really the issue? It's more, you are getting tent communities appearing. There's pressures on tent communities. Yeah.
Sorry, I missed that.
Yeah.
Yes, right, yes, because of the shocking housing affordability crisis.
Yeah.
Yeah, absolutely. Well, I mean, we're talking about, a very real issue, and perhaps a little bit outside the focus of, what we're talking about today. But I mean, also social and cultural shifts and evolution. And I mean, the crisis that we're facing in housing affordability it's just incredible. And perhaps this, well, if I can be provocative for a moment, maybe this might be a good thing to incense communities to think, my goodness, people are actually having to erect a tent in the local park because that's their only means of getting any shelter. We've got to start demonstrating. We've got to do something about this. I mean, the level, there should be a much greater level of outrage, and why isn't there? So perhaps something like that would start to force all of us to be suitably and appropriately outraged. But I was just also, it's not that point, but I know just at the moment there's a raging debate going on in the inner west, in the Gadigal and Wongal country here where I am, and the debate is about the provision of a skate park for local kids who are keen to have a great skate park, and the proposed location of the skate park is adjoining a major reception centre. And yes, I think it was actually in the Land and Environment Court today. I don't know the outcome. It was the convention centre of requested an injunction to stop the work. So, but we've already lost a lot of trees for this development. So, I mean, and this is in an open space area. It doesn't. There's residences relatively nearby, but not adjoining. So again, meeting a very different need, that particular open space, or meeting a particular need, but how do we resolve these sorts of conflicts? Not easily. But Brenda, what would you like to say?
I think that's an interesting provocation as well, Jack. I remember going to a university discussion on landscaping at some point, and there was a discussion on the fact that all these students were walking across this way, this green, and creating a path, right? And the university had to keep regrassing that area. And then it came to the point where someone said, well, if everyone's walking that way, why don't you just make it a path? Would that not be easier for everybody? And I think it was very hard for an established system to be like, oh, I'm going to make a not path a path, right? But let's look at what makes sense for the community. And there was obviously a disjoint between this is like people go from, I don't know, the deli to their class, right? Every day in between lunch. And so I think this is what we're saying is we have to understand how people are using things, and then we have to think about how we design things. I mean, I think the tended community is different because maybe they don't want to live there, but maybe there are people who want to live in a more naturey space. And so they choose a different way of living too. So I know in Brisbane, we have one man who wants to live in a park, and he's lived there for 40 years, probably. And he has decided, I want to live in this. It's become almost like a grass median between two large roads. But there has been some kind of cultural understanding and acceptance that this person wants to live in a park. He's always going to live in the park. He doesn't bother anyone. He's just going to live in the park, right? And I also, we do some work in Darwin where there are a lot of Aboriginal tribes that come in to the city to use the hospitals, but they don't want to stay in a hotel, or they don't want to stay in I don't know, an Airbnb or something. They want to stay in the long grass. And so there has to be some kind of community conversation about, well, this is one set of stakeholders that want to use a park, and they've chosen to use a park this way. So like there has to be either it's a complex problem, and it's a problem that requires a lot of communication and a lot of discussion, but it has to happen. Otherwise, there's going to be conflict. And these conflict at times, I think this conflict is what people are scared of. But the conflict is actually necessary in order to for us to figure out how do we use these public spaces to the greater good of all those that need to use it and want to use it.
And we might not realize that unless we had the actual park there to gather that data and to be able to work to solve those problems. So yeah, thank you very much. Yeah, very, very insightful. Thank you.
I had a question following up from Jack's. Two aspects to the question in relation to equitable access is security and lighting in parks, and potentially a concern for certain groups, like women. There was a case in Parramatta where a young, I think, Indian lady was walking home from work and, was sadly stabbed. So that as a potential concern and a deterrent of park use, and disabled access, ramps, access to disabled toilets, which could particularly be an issue in older areas of Sydney where that sort of access has not been provided. And the second aspect is upgrade of aging infrastructure in parks, again, like toilets and pathways. Was that brought up as a concern or as a potential metrics to assess the usability of parks?
Well, Brenda, do you want to jump in?
Yeah,
or?
I was sure. I would say both those aspects were considered as park quality. So being able to use a green space and be comfortable in a green space is definitely one aspect of it. I don't know if it's ever been used as a metric as in a single park or in a network of parks. But that definitely was brought up. Lighting was brought up as well, and safety. Lighting is a hard issue, I think, because just because there's light, I don't think means that you're safe. And there's also the other aspect of there's a lot of research going on with nighttime lighting and biodiversity and what that means. I think safety in parks is actually much harder to measure than lighting. I think that it has more to do with a cultural way that we see and use parks. I grew up in New York City, so I don't go to parks after dark, right? Because if you go to a park after dark, you're going to get mugged. and you should be expected. Like you know, that's what happens, right? You get mugged in a park after dark. So that's what I grew up with, and that's a cultural kind of norm and acceptance that becomes part of life. I've spent the last 3 months in Stockholm, where I was walking through a forest in the city to get from my apartment to Stockholm University. And that my first instinct was, I'm going to get mugged. I'm going to get mugged. I'm going to get mugged. But it's a different culture. And so the culture in Stockholm is that a park in an urban forest, it's a public space for all to use however they want, right? Whether it's camping, sleeping, going to, like picking mushrooms for dinner, there's a very different concept, and it's considered a space for everybody to do what they need to do for in their life. And so I think the people I met in Stockholm were very surprised to think that would be an issue, that someone would be hurt or mugged. And so I think there is a cultural norm that gets set with what is the acceptable behavior in these different public spaces, and how do we as a community actually address that?
And yeah, really great insights there, Brenda. And if I could just add, Rupert, the issue of disability access did come up a lot in the focus group, and I mean, if we can provide access for people with disabilities, then we're going to be providing access for everyone. So yeah, that certainly was something that came up quite a bit throughout the discussion.
And I think it's connected to that aspect of equity, that parks are a free space for everyone to use. So someone even brought up the fact that a lot of care workers, nurses, they actually really value the parks because it's a space that different nurses and care workers can bring people. They can spend time there. They can socialize there. It's usually safe. There's also and if there's the provision of these facilities, it becomes a really important outdoor space for that group to use.
And with all of those associated benefits, health benefits, just being in a green space for someone who is possibly, not able to walk at all, or, being pushed in a wheelchair, or I've even seen people being pushed along very smooth paths in a large green expanse, being pushed along, in a bed, and just the fact that they can be in that outdoor space and see the green can be so important just for their feelings of self-worth, and just feeling their mood lifts, and it's just so important. I'm just conscious we're probably running out of time here.
Yeah.
Sorry about that.
We've passed 5 o'clock, and I'm sure the discussion can continue via email directly with you, Susan and Brenda. Thank you so much for such an insightful presentation on a really important topic, and your work on such a huge project with a multidisciplinary team and a large, very competent team. And now, before we finish up today, I just wanted to introduce a housing market related theme for the next seminar to be held at Parramatta on the 18th of November. We'll have 2 international speakers, Associate Professor Esther Sullivan from the University of Colorado, Denver in the US, talking about manufactured insecurity, mobile home parks, and America's tenuous right to place. And we'll also have Associate Professor Martine August from the University of Waterloo in Canada speak about the financial of housing in Canada. So we look forward to you joining online or in person in Parramatta. And thank you very much for coming along today.
Thanks very much, Rupert, and thanks everyone.
Thank you.
Bye.